Oh, let me go backwards here, guys, quickly and answer some of these. Um, does bube have an effect on testosterone? Yes, you get hypogonadism. That's a common effect with any opioid long-term use. And way to fix that is to basically get a free testosterone early in the morning. Your primary care physician should be able to do it. And that's that. I make it a little video about this. But again, keep in mind it's not just bube, it's any opiate long-term use. It can do that. If you lose the feed, click off and click back in. Tell me if I'm all good, Nicole. Audio all good on this. And oh, thank you, Mark. It's okay. I'll use headphones. Hopefully, you can hear me, Crystal. We're still here. Okay, all right. All right. Did you guys lose me? Do I need to go over anything I've seen? Let me see. Here's one from Son of Saturn. Hi, Doc. I've been on methadone for almost a decade. I feel like a zombie, constantly tired. Have you seen any successful attempts of people like me who switch to subs? I'm worried about relapsing. Son of Saturn, I do that all the time. I When they want to do that, I keep close contact with the methadone clinic so I can taper them down to where I want them. You want to ideally be less than 30 milligrams. It's a little tricky switching from methadone to Suboxone only because methadone really gets in your adipose tissue and it takes a while. You use the same, you don't look for it in the urine. Because if you take Suboxone too early on methadone, methadone is a full agonist, and it can put you into
You're doing good. Just watch and make sure that you stay in the yellow right there.
stay in the yellow. Okay. Yeah, so when you're switching from methadone to Suboxone, keep in mind Suboxone is methadone is a full agonist and Suboxone is a partial agonist or agonist antagonist. So if you take the Suboxone too early, you can go into precipitated withdrawal. What you look for when you're coming off the methadone, number one, you got to be 30 milligrams or less. Number two, you use the same methods, clinical opiate withdrawal scale, except instead of taking a few hours or up to 24 hours, it could take a few days. So when I do this, I really try to keep patients close at hand and follow them daily so I can make a successful transition. Number two, I do think you can feel much better because keep in mind, methadone, what makes it a great drug is that it's long acting. So it makes it really good in terms of the fact that you don't have to keep redosing like something like heroin, fentanyl, or whatever. What makes it, there's many things that make it bad, but it's the fact that it is a full agonist and you can have that euphoria amongst some other negative things. So, yes, you can switch. My thought on it is you can feel much better. And I don't know what dose you're on, but I hope that helps, Son of Saturn. Okay, let me see. Okay, testosterone, yes, 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 yes. Uh, okay, I'll put my face closer to the mic. Uh, where is this? Hi, Misty. Dr. B, how do you know what dose to start? I was on 20 to 40 milligrams of Percocet for several years. Now flip flop with kratom. Yeah, I certainly don't recommend kratom. I've made some videos about that. Now, are you talking about? I assume you're talking about the Suboxone dose. You have to have someone walk you through it. I don't want to give you medical advice here. I personally make sure I do all the inductions myself and titrate them up so they don't go into precipitated withdrawal. I'll give you a general overall picture. Number one, you got to make sure they're at a place where they're not going to go into precipitated withdrawal. Number two, I'll start at 4, 2, depending on what the patient's situation is. 4 milligrams, and I titrate up in 24 hours. And over the next 2 to 3 to 4 days, I sort of adjust the dose and the frequency of what they take. Keep one thing in mind. This brings something else up, is that I hear a lot of people, they'll be like, oh my God, you're on 12 of Suboxone or 16 or whatever. The average dose of Suboxone across the planet that works, and when I say works, you are supposed to take this medication to clinical effect. The average dose is 16 to 24 milligrams. Clinical effect means in a 24-hour period, you have no evidence of cravings or withdrawals. Hope that helps. Let me see. Okay, audio good now. Good, good. 150 hours into detox. Will I feel better soon? Suboxone Wars. Uh, Suboxone Wars, I don't know what's going on if you're on any kind of medication, so I'm hesitant to answer that. Uh, I'd like to think you'd be feeling great after 150 hours, but again, I don't know any details about your medical situation and what medication they have you on. Dr. B, I have a question as I just now made it to the live stream, but wanted to ask a quick question. Sure, Bailey. Go ahead and ask. God, I suck at this thing. Uh, wow, there's so many questions. Uh, Hi, guys. Dr. B. Shared out. Bailey. I've been on Bunavale Buca Films, Buckle Films, and the pharmacist didn't have enough to fill my script for the month. I had enough for 14 days and said there was a shortage. Yes, there is a shortage. Whatever you're on, Bailey, you just so if you're on the, I think 4.1 or 4.7, that's equivalent to 8 milligram of Suboxone or 8 milligrams of Subutex. Some of my patients had the same problem. I called the pharmacist. I switched them all over to another product, whether it's Subutex or Suboxone for now. Okay? So that's what your doctor should do. Uh, yes, I have a 15-month-old boy. He's my boss. Uh, hey, man, it's okay to taper off. Hey, man, is it okay to taper off 25% every month off of 1 milligrams of Ativan a day, especially when a few months ago I was taking zero point 0.5 a day for some time? Israel, I've been there. I've been to Haifa. I've been to Tel Aviv. I've been to the Palestinian territories, but it's been a long time. Uh, I think you're saying you're on 1 milligram, or you used to be on 0.5 a day. That being the case, yes, 25% every month should not get you sick. I have a video on this on how I do my benzo taper. Check it out. But in terms of the fact that it's such a low dose, 1 milligram, 25% a month should be okay. Do consult with your own physician. And just for some thought, I do have a video about all of that. Dr. B, what do you think about this virus? Any advice? Grind and shine recovery. Ask me something more. Is that? I can barely see. I think that's. Ask me a little more specific, and maybe at the end here, I will give you guys my thoughts in general about this advice. Keep in mind, I kind of did this for living, running, helping. I was senior faculty at a large emergency department, academic department. So I'm pretty well versed in that stuff. Uh, Australia, cool. Going on 9th month after detox. Hi, Mac. Hey, Doc, I'm the one who asked about testosterone. Hey, James. Hope that helped. Yeah, you just got to if you have fatigue, if you have any sexual issues, uh, get a level drawn from your doctor. Talk to him about it, please. Uh, what are you doing? That's all you're on is clonidine, Suboxone Wars? Oh, I don't want to give medical advice here. I would probably treat you differently in my program, but with 150 days out, only on clonidine, depending on what your issue is. Again, I'm real careful without knowing that those of you that are my patients, you know that I know everything about you, and that's called the clinical history. And it's unethical for me to give you advice or tell you someone is doing something wrong. I don't know Suboxone Wars, but depending on what your issue was, just being on clonidine 150 days out may be rough if it's the usual suspect. I split my dose ever since my pregnancy on methadone. Okay. Uh, how's your okay? Thank you for your response. My levels. Uh, sure, I'm down to 2 milligrams. Hey Nicole, how's your taper going? Does Suboxone help long-term chronic pain as much as slow-release morphine? I love that question, Don. I am going to say it is much better than slow release morphine for a million reasons. I have a few videos out on this topic that this is a pain medication. I will say this. I have a patient that just came from San Diego. I have a patient that flies out from New Jersey. I have a patient that flies out from Arizona. I have a few local patients of the same issue. These are all chronic pain patients that were on high dose. In fact, I have one coming Monday from east of where I am, Orange County, California. I have, yes, it does. It's the better way to go. And it's a lifesaver for people that have been, many of these patients that have been, again, I have to know the case history and see if you're a good candidate for it. But it absolutely, I would say, is a much, much, much better drug than slow release morphine in general without knowing the particular case history, Don. I hope that helps. Son of Saturn, oh, you're on 160, not too low, not too high. It'll be hard, but I see my life bypassing by. Yeah, son, I don't know where you live. You want to start a taper down and get some support for that taper. Find a good Suboxone doctor where you're at that really understands this transition and how to do it and make the transition, buddy. Okay? And we're here to support you. I don't know where you're at. If you want, come on and say hello and see me. Uh, Misty, hi Misty. Good. I gotta get a hold of you. Anyway, giving me 20 milligrams. Only compared to I have a home. Big difference with them. Okay. I'll talk to you soon, Misty. Uh, Hi Cindy. Nice to see you. Uh, didn't know MAT was considered essential by WHO. It absolutely is. Does that give some leverage when trying to get into pharmacy to see doctor? McClarty, I think you're in Australia. I don't think it does necessarily. Not at this time. One of the effects that this whole yeah, I don't think it does. It depends on the country and if they respect WHO, which everybody should, because it has the best, most solid data out there. Dr. B does the. I don't know what the Bernese method is. Please tell me, Nathan. Um, Thanks, Cindy. We all miss you. Thanks. Okay. She's on lockdown. I can't even see her. She's. Uh, oh, okay. Well, I give her my prayers too. Let me give you guys a little bit about the virus that's going on right now. Uh, and I spoke about it the other day. And if anyone has any questions, ask. One of the things that's happening out here is I think this comes, I'm in California, and I'm assuming it's the same everywhere. Uh, this came down from the feds and then to the state. Because of what I do and the type of patients I see, you don't really want to do telemedicine, and certainly not in the IOP program. You know, everything you're supposed to be there for insurance compliance and so forth. That being said, it has sort of been okayed. It is okayed now and wavered that we can do this through telemedicine, which is a wonderful thing. So I'm really trying to work with all the clients to meet their needs, call in their medications, do telemedicine with them for now until I hear otherwise. Number two, I just kind of want to reiterate. Uh, oh, no. Yeah, I know the. Sorry, Nathan, I do know the method. It does not work. Yeah, is that what it's called? Yeah, I've heard of that. It's a little bit off. No, Nathan, I don't recommend that. I recommend making a complete switch. It's kind of a little dangerous thing to do, but it doesn't. There's no evidence that that works. Uh, so back to what I was saying. Conscious saying she got 13 to take home. Is that 13 Suboxones or methadone doses? So anyway, I'm sorry. So this makes it really easy for me as a prescriber. It also makes it really easy for us to do the groups and individual therapy sessions because we're all doing it on telemedicine now. I'm very relieved about that. Okay. Number two, people seem to be panicked about getting their doses and so forth. I don't see a major shutdown of these medications. Um, um, so, as long as it's available, I'm going to prescribe it in the way that I can within the law, and I don't want to overprescribe it so people can hoard it because then we can get into a situation. Um, what I do think about the virus is that I think this week we're 18 to 20,000 infections in the U.S. Uh, it's in every state except Antarctica. The death rate is about 1.5%, 200 and something. I think within the next week, guys, you're going to see at least a doubling of that number of cases. At least. This is on the uptrend of the curve. Okay. Uh, my concerns are so number one, the testing has been not appropriate. So as soon as we get testing going, you're going to see a lot more cases. Number two, this is on the upswing of the curve. So I think this sort of pandemic issue and epidemic locally is going to be getting a lot worse. So keep an eye for that. Let me pause from that and go back. Nicole Marie. I'm on methadone. I've been on it for almost 3 years. I have chronic pain with my back and my knees. My methadone isn't working as well for my pain. Is it possible to go up a little bit? Nicole, what's your dose of methadone? And Dr. B, this cue came from your Facebook group. Dr. B, can you talk about this drug used for malaria? Yeah, yeah. Chloroquine. I don't know why they're approving it. I don't think there's that much data yet or that much known about it. I didn't look into why they chose that one, uh, but I will look into it. But I can tell you right now, we don't have that much data about it right now. And the drug can actually be, I am familiar with the drug for malaria. It can actually be pretty toxic. Why? I haven't looked into why they came up with that drug. There might be some data, but I don't think there's much. Okay. Hi, Emily. Emily says, happy to be here. I'm a new subscriber of Nicole's. Currently pregnant on Suboxone. Should I be worried about this virus, my baby? Emily, are you on Suboxone or Subutex? Because you're supposed to be on Subutex. And should you be worried? Um, you know, you should be careful. You're pregnant. You should be as worried right now as you should be about the seasonal flu, influenza A and B, which we have a lot of data on. We don't have that much data on this virus yet, but you should be cautious and careful. Uh, I don't know if I want to use the word worried, but you should use all of the precautions that they're saying, and I would stay away from most people and wash your hands a lot. Don't touch your mouth, and you should be okay, Emily. I'm more interested in if you're on Subutex or Suboxone, because if you're pregnant, you need to be on Subutex. Mama of Kenny, my question about the virus: how can they say you have it when they don't test you? I'm not sure where they're doing that. Yes, Rintin, we do need to flatten the curve. Um, but the truth is, this virus, to the extent that we know about it, it could very easily be confused with the seasonal flu, influenza A and B. Okay, uh, it has some twist on it. Again, as I read those, I don't want to say those, but symptomatically, in truth, you really can't confirm it unless if you get the test and to see if it's influenza or the coronavirus. I hope that helps, Mama of Kenny. Thanks, keep pushing. Gabor Mate, total badass. Big fan. Always have been. In fact, to be completely honest with you, uh, when I started doing this, I stole a lot of my approach to care, my concern with the sociology of addiction, the concepts of corporate capitalism and its effect on society and individuals. I stole all of that originally from Gabor and then eventually grew up myself. Oh, you guys are going too fast. I'm not that good at this stuff. Perfect wine. I stopped taking Suboxone 80 hours ago. It brought me into heavy withdrawal. I took some kratom about 3 hours ago and I feel too good. Is this going to reset my withdrawal? Wow, perfect wine. I don't know why you did that and how much Suboxone were you on. This is going to get complicated. I advise you to get a physician that really understands both those drugs. And again, it's hard for me to comment. I highly advise you against doing what you did, and uh, please consult a physician or something. I don't like what I read. Be careful, wine. Hey, Cindy. Sorry, this is my first time eating today. I've been working since really early. I'm just eating some peanuts. I apologize. Okay, Heather. Heather, I don't know where you're at, but you can still see me. I got patients coming from all over. If I need to see them, I will see them. Uh, just make sure you don't go without your medications and all that stuff. Okay, Heather. Wendy, thank you. Uh, by the way, guys, I think if things are shutting down now, I could be wrong. I don't foresee within the next few weeks things opening up. So be really careful, okay? Uh, first week of detox is the worst. Uh, Emily, let me kill this thing here. Yeah, not perfect wine. Perfect wine. It's not like restarting from day one, but again, it's a dangerous mix here. Okay. Um, I'm a little hesitant to say more about this because I don't know your particular case. Okay, my dear, I would love to really tell you more. I just don't know enough about your particular case. Um, Nicole, 150 milligrams of methadone. McLarty, I didn't uh, I didn't comment on Boost Bar. It's not a clonidine alternative. It does okay for some people on for anxiety. Some people it does great. Some people it doesn't do much. It's a pretty benign medications. Uh, oh, Emily, yeah. So Subutex does not have the naloxone in it, which has not been approved for pregnancy. So you are not supposed to be taking Suboxone because it has the naloxone in it. Uh, when you're pregnant, you're supposed to take buprenorphine or Subutex, which is the same thing. Please go talk to your doctor. They should actually be all over this. Um, I'm in Orange County, Southern California. Santa Ana, yes. Thoughts you would say this and see him teaching me so much about my thanks again, man. Much love. Okay, keep pushing. Uh, Sorry I was eating, guys. It's just a long day. Okay. Thanks, Captain. I'm trying to get off Suboxone currently. How quickly should I? Wendy, I don't answer those kinds of questions either because I tailor the tapering for each individual patient. I'll give you a general thought that I have. When you're on 8 milligrams, and my question to you would be, how old are you? How long have you been on it? What frequency of opiate and heroin use did you, or whatever it was, did you have before? What dose did you start the subs on? Like I said, how is everything else in your life going surrounding the specifics of your addiction? And in that way, then I start to taper my patients when they're ready, uh, if they're ready. So I can tell you that, Wendy. So how quickly it's about, and I tell you, there's no science that we know of when to get someone off of this medication, and I'm okay with that. And I tell people right when I start them that I don't know when and how you should be coming off, but let's get you on first before everything else in your life goes down the drain. So that's how I look at it. Okay. Uh, Heather, just give me a call at the clinic. We'll figure something out. Don't freak out. We always figure it all out. Crazy legs. I don't know where you're at, but sure, come see me. I'd love to. I get people from all over the country. Hey, Mark. I've never seen someone advocate for us like you do. Well, Mark, it's my it's my pleasure. Uh, I always feel like I need to do more. Thanks, Misty. Uh, James, 4 milligrams, then that still doesn't really. Uh, James, I don't know why, if it's just for the pain, but if it needs to be increased, I would talk to your MD about it. I'm never concerned about increasing buprenorphine to clinical effect because, in terms of risk versus benefits in general and the quality of life and alternatives, I'm always down to increase the buprenorphine to the clinical effect. Once they start hitting 4 and go over that, I only have 1 or 2 patients that are more than 4, and that's off label, and I follow them closely. Thanks, Cindy. If 20 milligrams of buse satisfies, that's fine. Chronic pain. I got chronic pain people all the way from 2 milligrams to 32 milligrams. Okay, James. So I'm okay with that. The crazy legs, it's not about 15 milligrams. The patches are micrograms, uh, and that's how they are. They're weak patches for a and it's not a high dose. Can I do this time every week? I wish I could do it. We'll talk to the team, guys. I'm so busy. I go 7 days a week. All the time. And as Nicole says, I have a 15-month-old. Uh, so my nephew's watching him next door right now. I'll try and get something set up here where I can do this. Uh, Nicole Marie, I think you had some questions. James, when it comes to, I don't know what your issue is. When it, as far as reducing it, uh, I don't want to comment too much about it. But if you have a chronic pain and you're going to have chronic pain issues for life, you know, you have to think about what are your alternatives. That one versus a straight opiate, which can get you in a lot of troubles. So think about that and do talk to your physician. I hope they kind of look at it in the same way I do. And really, that's what the literature says. Guys, I'm having a hard time on here because I suck at these things and I'm old and blind, but I'm trying to go through this. I hope my answers are making sense. Let me move up a little bit. Okay. I hope you guys can hear me. Uh, yeah, Emily, I'm surprised you're on Suboxone. You're pregnant. You need to be on Subutex. That's the law of the land. Okay, this is a cool one from Lakiva Grady. 190 milligrams of methadone, 15 months, detox down to 60, jumped off clean slate, worked very close with the clinic, and nice, and switched over to Suboxone after 5 days. Beautiful. Yeah. So you got a really competent clinic. Most of them have a rough time with this. When people do come to me, I just sort of take over and contact the clinic and make sure they get their daily dose. It needs to be very close follow up. Okay, guys. Uh, yeah, I wouldn't be too worried. Cindy's right. It's a precaution, but it's just something you got to be down. So you'll be okay. And Cindy's right. I didn't mean to get you alarmed, but it needs to be changed, my dear. Okay. Okay, Hunter, thanks. Hunter's my nephew. He's the technical and my babysitter today, and he's our technical guy. Uh, I was under very close care, but I was being taken down to 10 milligrams a day, so it kind of went through hell. But I wanted to come off methadone and switch to sub, so that's what it took. You know, they could have made this switch at 30. Uh, I take Subutex, yes. Klonopin, I take Excedrin twice a day to help it. Cindy, don't take too much Excedrin if it's got acetaminophen in it. But I'm sorry if it's got ibuprofen in it. I can't remember if it's ibuprofen or Tylenol. If you do take it with a meal. Uh, Thanks, Captain. Uh, Hunter. Where is this stuff? Let me check something, guys. I think there was some other questions on this thing, and I want to see if I know how to uh, figure it out. I can't find it. Okay, let me see. Where are we? Sorry, guys. Uh, Thanks, Captain. Is Nacenta? It's an opiate. Good drug. If it's crazy legs, is it for chronic pain? What is it for? Uh, Hunter, you're getting some props wherever you are back there. Cindy's too kind. She's not rough on you like I am. Good. Uh, yeah. Again, who asked about the? I think it was Nacenta. Yeah. I mean, good drug depends for what and for how long. Crazy legs. Hey, Breaker, I answered you. What I said was no, there's no real solid evidence that this stuff boosts the immune system. So you're not getting sick for other reasons, whatever it is that your body is made up of, your immune system is made up of, your interaction with the environment. And you're the second person that asked me that, Breaker. But I don't see any data that says this stuff boosts your immune system. Hope that helps. Okay, Cindy. Oh, I'm sorry, spina bifida. Yeah, that's a painful condition. You know, I'm gonna shoot in the dark here. I don't know about the details, but this is something that I would actually have somebody on buprenorphine, Suboxone type of medications. Uh, is it dangerous to be on Klonopin while on Suboxone? Great question, Wendy. Uh, this is one of those areas. The concept, the overall concept is to be on an opiate, which Suboxone is an opiate by definition, and to be on a benzodiazepine increases your chances of, uh, well, if you were respiratory depression and death, but it could add to the euphoria. That's the general idea, and there is truth to that. Okay. That being said, I see a lot of doctors, a lot of pharmacists. They really freak out when someone's on a benzo on subs. Well, 70% of my practice is probably on benzo on subs. You just have to, number one, you're going to have to take a lot here to affect it because Suboxone doesn't work like other opiates. Okay, remember the primary issue is opiates and benzos. So, number one, we're not talking about someone using heroin or oxys or whatever, fentanyl, and then taking a bunch of Klonopin or Xanax. Okay, but under the right conditions, you have to remember most of my patients, most addicts, they do have some sort of underlying anxiety or they do have an anxiety secondary to their substance abuse. Whatever the primary reason is, anxiety is a large component of their life. And some of them, at least for some time, need anti anxiety meds. I've made some videos about this stuff. And in that case, no. If you understand the pharmacology, if you're regulating the amount that you're giving and understanding that Suboxone products, buprenorphine products, yeah, you mix them with a whole bunch of benzos, it's really going to be hard to overdose because of the mix. You should be okay. So that's my answer. But if you're taking Roxy's or you're using heroin and you're taking a bunch of benzos, yeah, you're increasing the negative side effects and your chance of overdose a lot more. Hope that helps, Wendy. Uh, this maintenance medication, we were given an option to sign a paper out so that medicine go directly to their pharmacy. Yes, Lakiva, I'm doing the same thing, just doing visits through online with my patients right now, and I think the state's okay with it. In fact, that's where I got the sort of the to go green light. Doctor, can generics be less than 8 milligrams, 20%? I heard. That's an interesting question. I never used to believe it, but I do think that its absorption and delivery and all that stuff, there seems to be some differences for different people. And I don't know if 20% is the right number. I think it differs with everybody. And I think it's real because I see it so much. And I know my patients so well. People aren't lying to me. So it's a concern. And it's something to just look out for and communicate with your clinician. And I don't think you have to put a number on it, but it's real for a lot of people. I was going to tell you, Emily, get off the trazodone, stay on your Effexor. Your doctor is a smart guy. I agree with him. Again, these are general comments I'm making, guys. I don't know your particular situations. In general, I don't like trazodone and I don't like Seroquel for sleep. I think Effexor is a great medication. So Emily, talk to your doctor, and in general, I agree with that kind of idea. Thanks, James. Uh, I think so, Misty. I'm reading some of these guys. Why does gabapentin stop Suboxone withdrawals? I'm on GABA as well, and I've not asked my doctor that because I didn't know. Well, gabapentin, it doesn't necessarily stop the withdrawals. It's a supportive medication that can be used. Let's say if you're detoxing someone off opiates, it hits a slightly different kind of receptor than your benzodiazepines, kind of. It's GABA receptors, but it's a different one. So this can have a very sedating and calming effect. I do warn you, gabapentin is a substance of abuse, and you can build a physiological tolerance. And in general, again, I'm not talking about specific cases, guys. Depending on the dose, I personally, my opinion is that I would not, unless something weird comes up, I would not give somebody gabapentin to get them off Suboxone because I think it's the risk benefit of each one of these medications is vastly different in terms of the fact that gabapentin is a lot more toxic in the short term and the long term. Uh, that's my thoughts on that in general. Jackie, I can't quite remember. I think Seroquel may cause some weight gain, but I can't quite remember. I should know it. The liquid and pill form, this is simply an absorption issue. Feel good, he asked, the Feel good asked, he was on methadone liquid form. He'd feel good for 24 hours. The film works at best 15 hours. It's just probably absorption. That's all. I think I've answered quite a bit. Nicole, how many people? Oh, wow, we got 31 people on here. How interesting. I hope I'm answering everything, guys. And I'm sorry I'm still eating. I'm starving. Yep, it's a ghost town out in Orange County as well. And it's a nice day out. I like it. Um, but it's pretty quiet and eerie out there. But I do enjoy it. Well, that's a lot, Nicole. Is Austin on here? Thanks, Crazy Legs. Pretty cool name. And Nicole, how long should I go? Do you think? I know you do these all the time on your show. They're great. By the way, if anyone's not, hasn't been on Nicole's channel, Real Talk Recovery, I'm sure most people here go there. She is awesome. She is a great advocate for the substance abuse and recovery community. She has a heart of gold. Her channel is awesome. She works hard and diligently at putting out stuff all the time. She gets, she's sort of like the, what do you call it? I don't know what the term I'm trying to look for. The thankless warrior out there just doing good. I love her channel. I actually got to know her because I was like, wow, this girl actually knows what she's talking about, and she's so committed to this community. So she's awesome. So she's on here. A shout out to Nicole. at Real Talk Recovery, and she kicks ass. BT Brian, thanks for doing this. Just got here. I saw you mentioned on Reddit. We'll go back and watch it all later. Okay, BT, is there anything I can answer for you? Yes, doctor, I totally agree that a lot of addicts, after coming off drugs illegally, are very depressed and deal with anxiety pretty bad. My doc has me on nice 0.5 of Klonopin. I like it. You got a good doctor. I feel so much reassurance to have second medical professional opinion. We'll definitely be looking into making it. Sure, Emily. Keep in mind, I want to just just for my own protection, I'm not giving medical advice. I'm giving general responses to the information I get from you guys without going into your specific details. Always consult your physician or come see me. I'm down here in sunny Southern California. Those changes from a happy, healthy baby. Yes, Emily. Oprah of recovery. I like that. She is the Oprah of recovery. Although she's much cooler than Oprah. I don't like Oprah so much. Uh, Nicole is a superstar. She absolutely is. Marilyn Monroe of recovery. That I like. I'm down with Marilyn. Sure, Nicole Cummings. What was your question, Nicole? Ask me again. I don't want to skip it. If I missed it, let me know. Okay, Nicole. I practice in California, Southern California, Orange County. Andrew, that's a great comment. Sure, Lakiva. Yes, crazy, come see me. Let me answer Andrew's. Andrew, I don't want you to say anything specific if you don't want to. I guess my question would be, what is your pain issue? How old are you? How much Suboxone have you been on? So, the devil is really in the details. And can there be someone where this doesn't help? I mean, I have patients, everything from lupus, multiple sclerosis, vasculitis, amputations. I can go on. That this is chronic headaches. So, I'd have to know. I'm not. I'm absolutely validating your reality. I'd have to know some more medical details. And if you want to talk about it, call me. I don't want you to have to say anything in detail here. Okay, Andrea? Uh, can buprenorphine have effect on testosterone in the long term? Yes, yes, BT. I just answered that. It's one of the side effects of buprenorphine. You get hypogonadism, low testosterone. It's a potential side effect, not only to buprenorphine, to any opiate medication you're on. So keep that in mind. It's very easily treatable. You get a free testosterone level in the morning, and it can be treated with a cream. You need to talk to your doctor about if you're having symptoms of hypogonadism or low testosterone. But yes, it is one of the long term side effects. And again, the risk benefit for me, the benefit far outweighs this minor risk that can be treated pretty easily. Does the FDA still have you limited to 500 per doctor? It depends on the doctor. For me, I think it's either 300 or unlimited. I don't remember, Breaker, but it's 30. I don't. Your first year used to be 30, but in my case, I think I'm either 300 or unlimited. I don't even know. You got to talk to my team. They know. I know very few things in this world, guys. I barely get by. My nephew Hunter, my assistant T. Uh, so Nicole is a badass. Uh, I'm on methadone. I'm going 150 milligrams. I have chronic pain with my back, my knees. Uh, I'm being tested for MS. My methadone is not working for my pain as good as it used to. Can I go up? Nicole, again, I don't want to give medical advice here. I don't know your age. I'm going to assume you're in your 30s because you're being tested for MS, maybe in your 40s. But what I will say, and I don't know anything about your particular circumstance, what I will say, and 150 milligrams is not the pain dose, so I'm going to assume there was some history of opiate abuse here because pain doctors won't go up usually to 150 milligrams for pain management using methadone. Having said all of that, in general, I'm going to say that buprenorphine products is a much safer and a more powerful way to go here than methadone. Again, I see some numbers here 150 milligrams. I'm going to assume that actually was not initiated for pain, but initiated for substance abuse. I could be wrong. And two, going up on the dose for pain. I don't know much details about your case, but if someone like that came to me, I'd really want to know what the heck is going on, and I would really like to taper him down and switch him to Suboxone. Uh, Keep in mind, for as much information I got, that's about the best I can do. And I'm going to assume you're in your 30s or 40s. Yes, devil is in the details, crazy. Crazy legs. My pleasure, Carissa. Carissa? That's a cool name. Is Austin on here? Hunter, can you help me? Did I miss anything? I'm looking back to see if I've missed anything, guys. And Miss Cummings, I hope that answered your question. No, Breaker, if you're talking about buprenorphine products, I don't recommend anything. As soon as I get to know my patient and I'm certain there's no diversion, uh, okay, McCarty, thank you so much. Making sure there's no diversion, I uh, I kind of go with the patient and see what they're comfortable with. I make that decision based on uh, what they like and what they can afford and what the pharmacy has, and we kind of work together to figure that out. Thanks, Nicole. Uh, Hi, Jean. Yeah, I did need help. Give me
You all good right now?
yeah, I think we're good. I was wondering if this current coronavirus have any impact on MAT meds available. Great question. It's kind of been asked. Thank you, Nicole. Let me tell Gallagher. Uh, so the meds availability, I'm going to say this. I've had patients come in very paranoid, asking if they can get higher doses so they can have more number of this stuff. So, and do I end it now?
Just whenever.
Oh, so they can actually have more to stock. I'm hesitant to give this, and I'll tell you why. Uh, I'm hesitant to give patients more to stock away because if I did that, I would be feeding into the panic and the way people are behaving in stores, taking away all the wipe stuff, the products for cleaning, and I'm going to assume that we're all going to be responsible here. If I start feeding into that, then there will be a shortage on medication assisted treatment. So I'm hoping we don't get there. Uh, and besides that, I'm making myself available to patients at all times in any way, shape, or form to make sure they get their medication. And I work with pharmacists to be able to do that. Thanks, Sky. Uh, so that's. I hope that answers that. I think it was Kaiser. Uh, Thanks, Mark. And thanks, Nicole. Katie. Okay. Should I? Should I? How long have we been on, Nicole? Nicole knows how to use these things so well. Oh, thanks, Mark. Yeah. You guys, everybody, just stay very strong out there. Don't get panicked. Take really good care of yourselves. Wash your hands a lot. Practice social distancing. Don't go out if you don't need to. If you have things like diabetes, if you have asthma, if you have COPD, if you have heart disease, please understand, your susceptibility to more impact on your health is higher. So just remain calm, stay well hydrated, eat healthy as you can, and find your support community around you. Uh, so that you can make it through this, and we're all going to be okay. Uh, Carrie, I think that's a little too much at this point. There's no evidence for me to think that anybody should start tapering, and if people go that way, you're going to have a really bad situation on your hands. Not you, but in general. So, if I thought people should start tapering, if I saw any evidence out there, I would say it. And I'm trying to not create panic so people don't start hoarding up on this stuff. So I don't think so, Carrie. I read that a lot of clinics are going telemedicine. Is that yes? I am actually Breaker. I am telemedicine now. The state and the feds gave us the go ahead to be able to do that, and my IOP groups and individual sessions are all telemedicine now, which is kind of nice. So I am doing that, and I even do it from home. Uh, Thanks, McClarty. Thanks, Nicole. Great advice. Thank you for. Yep, Brian, my pleasure. Again, you guys be safe out there. Wash your hands a lot. If you have a fever or a cough, shortness of breath, get to the appropriate health authority. And everybody, again, stay hydrated and take care of yourselves. And we'll all make it through this. I think most doctors should be available and prescriptions can be done over the phone. Okay, guys? And thank you all for coming. Yes, yes, Nicole, we are. Yes, Rachel, I do the same. I'm doing it over video now. Hi, Captain. I got it, Nicole Cummings. Yeah, I think, in general, I think the same thing of switching over to Suboxone. Yeah, Carrie, I don't. Unless if I hear his reasoning why I don't buy it. If it's okay, Nicole, I'm gonna go play with my boy, and thank you, everybody. Nicole, thanks for kind of helping me moderate this. You are a superstar, and I am going to go if that's okay. Hunter, can I get off? Bye, guys. I think it went okay. Yeah. G. Am I off?